Hey guys, my name's Kylie, and on my channel I post a bunch of nursing school videos I have vlogs and I have other videos about nursing school, so if that interests you, then go ahead and subscribe below, or after you watch the video and you think maybe you found it helpful, then you can go ahead and subscribe below. But today's video, I am going to be talking about how I prepare for my clinicals the night before. So at the moment right now for this semester, my clinicals are on a Monday morning starting at 6:30. So I have to wake up at 4:30 to be able to get there on time. So obviously I really don't have a lot of time in the morning to prepare. So I do everything the night before. So if you're not in nursing school yet, you might not really understand exactly how the clinicals work unless you've watched some videos about it or read up on it. But basically the night before your clinical, you will go to the hospital that this is how we do it here, and I know that's how a lot of other places do it, but the night before your clinical, you'll go to the hospital and get your patient assignment. At some schools, your professor will assign your patient for you, which is how mine does, and at other schools, I think they might allow you to pick out your own patient. But at my school, we get ours assigned to us. And so I'm going to start there, and what I'm going to do is kind of show y'all the paperwork that we do the night before. So as you can see on the screen here, we are looking at a patient daily profile. This is the paperwork that my school has us fill out. I'm sure other schools are pretty similar. It might not be the exact same paperwork, but this will just kind of give you an idea of the information that you're going to be collecting. Now, all of this pretty much can be collected from your hospital's computer system or where they keep the patient's information. So, as you can see at the top, we have all of the patient's kind of general information: age, sex, room number, their doctor, primary diagnosis, allergies, allergy reactions, and then there's also a space for additional medical diagnosis. So, let's just say that your primary diagnosis was some type of wound. Your additional diagnosis would be if your patient has diabetes, if your patient has hypertension, if your patient has anemia, anything like that would be an additional medical diagnosis. I also like to include, if I don't have a ton of additional diagnosis, if they have a history of certain diagnosis, I'll include that here also. I'll just put like history beside it. Because I kind of feel like that'll give a bit better background information. It'll also have your code status, which is important to know, activity level, bath, is it independent, are you going to have to do it, are you going to have to do a full bed bath, their diet, because whenever you're handing out your food trays, you need to make sure that your food tray has the correct diet on it, any drains they might have, height, weight, glucose checks, what times are they done, what are the results of the most recent ones, are they continent, their IV site, the type, the gauge, the fluid, the rate. If they're having a surgery, you'll want to put the surgery date, the date post-op, or how many days it's been since the surgery, what fall precautions they have. We use I'm pretty sure it's called Mohs Fall Risk Assessment scale that we use to kind of determine our fall risk. Are they going to require any dressing changes? We also have space for intake and output, any other diagnostic tests, x-rays, CT scans, EKGs, stuff like that, and you'll put the results. Then we have several, well, this has 3, sometimes you'll need more, sometimes you'll need less, but 3 pages for their drugs. So in the medication part, you will put the medication name and the generic name, generic and brand. Usually it'll have both, at least in our medication administration records it does have both. And then you'll also put the therapeutic and pharmacologic class, dose, route, and frequency. Why is the patient taking the medication? Sometimes this is listed. I still like to kind of elaborate, like if in the MAR it says that the patient's taking something for pain, I would elaborate what pain, like what's causing the pain, pain from a wound, pain from what, any major side effects of the medication, any nursing interventions that you might need to do before you give or after you give the medication. Then we have a spot for all of our labs. So we have the like complete blood count labs, chemistry labs. Sometimes you'll have people get a urinalysis, any clotting studies, cultures, drug levels if they get tested for drugs. Then these sheets are kind of for your own, you kind of put all this into your own words, kind of analyzing it. Have you noticed any trends in any of the information? Are there any abnormal labs? What do you think is causing these? Assessment data that you find is pertinent. That part you'll fill out the day after your clinical, at least where I go to school, because the assessment data they're talking about is the assessment that you do like on your patient in the room. What disease process is causing these findings? So if they had cellulitis as their primary diagnosis, and cellulitis would be the disease process, and then you'd kind of give like a brief explanation of how it is causing those findings. Main or potential problems that you as a nurse can treat. So our PDPs have kind of a spot where you can include a rough draft care plan. And this is really helpful because the night before you've even met your patient, you'll kind of come up with the idea of what your care plan will be like. And then the day after, whenever you're done with clinicals and before you turn in your paperwork, you'll kind of create your real care plan based on kind of what you saw. But this allows you to kind of get some ideas for that and ideas for what to look for your real care plan. So you have main or potential problems you as a nurse can treat. What is the goal for the patient? And we use the SMART acronym: specific, measurable, achievable, realistic, and timeable. And you'll list 3 of those goals, and then you'll also list 3 interventions for each goal. Any other problems the patient might have, and then as you can see here, use all the information above to create your care plan. Then the day after, not necessarily the day after clinical, but after clinical, you will do this reflection of your clinical day. So what did you learn? What went well? What would you do differently? How will you use what you've learned in future clinical experiences and with future patients? And this is kind of like a self-reflection on your day. So our PDP is basically our clinical paperwork that we fill out the night before clinicals. And we have some other paperwork that we do as well, and I'm going to go ahead and show you all that now. So I keep all of my clinical paperwork in this binder, clinical binder. I've talked about this before in some of my vlogs, and I think I mentioned it before I even got the binder in my What's in My Bag video, but this is my clinical binder. And basically I keep all of my patient's information in here, or not my patient's information, all of my blank paperwork in here. So I'll show y'all. So going along with the PDP, so the same night before clinical, we also fill out a disease like concept map. And you can just kind of take a quick look at this. It's pretty self-explanatory. We've got disease process, the pathophysiology for it, subjective and objective signs and symptoms, labs and diagnostics, medications, nursing interventions, prognosis, potential complications. And this just kind of allows you to dig deeper into what exactly is causing your patient's illness or your patient's reason for being in the hospital. I also have these drug cards, and so these are what I put all of my information on. I put most of the basic information into my PDP, but the precautions and contraindications, side effects, adverse reactions, nursing implications, all of that I put onto here. And I like to do this because I can reuse all of these cards. Like the PDP, I really can't reuse that because it's specified for that one patient, but these I can reuse, and I'll show y'all. First I'll show y'all this. So these are my finished disease maps. And as you can see, I really do fill these out to the brim. And then these are my done drug cards, and as you can see, I have tons of these, but I can just reuse these. So like today is actually a Sunday, and I'm about to start my clinical paperwork after I film this, and I only have one medication drug card that I actually have to do tonight because all the rest of them are already done, and they're all here for me, ready to go. So after you finish all your clinical paperwork the night before, Some things that I like to do to kind of ease my day, like for the morning on clinical, is I wear the same scrubs I wore today just because all I did was take paperwork, and I will fold them up nice and neat and set them in the bathroom so that whenever I get up, I don't have to dig through my closet and wake up my husband. I can just go to the bathroom and do everything in there. I also put my clinical bag in there. Sometimes I'll put my purse in there, sometimes I won't, it just depends. And just so that everything is in there so I don't have to rummage around and waste time or anything like that. So I'll have my shoes in there, socks, my little, what do you call this, like an undershirt thing, scrub pants, scrub top, anything else I might need I'll keep in there. I also have all of my stuff set up for the morning. My hairbrush is out, my straightener's out in case I need to fix my bangs. My toothbrush and toothpaste is out, ready to go. Also, the night before, I will go ahead and pack up my lunch for the next day and stick it in the fridge so that it's all ready to go. I can just run in there, grab it, and leave. So, anyways, I hope this helped y'all prepare for your clinicals and kind of give you some tips and ideas. This is just what's worked for me so far. If y'all have any other tips or ideas that y'all use to help make your clinical day a little bit easier in the morning or help you prepare a little better, you can comment those below so that we can all kind of share our ideas and all be better together. And if y'all like this video, go ahead and like it because that helps me out. And you can also go ahead and subscribe if you like the video. And yeah, so thank you guys for watching. I will talk to you guys next week. Bye.